Decall the Middle Ages the age of faith. Knights battled, cathedrals towered, kings reigned. But beneath the shining castles and holy hymns, something else lurked in the shadows. A world so harsh, death seemed like mercy. This world was medicine, not medicine as we know it. Healing, relief, science, but something darker. Something born out of fear, superstition, and desperation. Medicine in the Middle Ages was not about saving lives. Survival mattered, no matter how much it cost. Close your eyes and imagine being there. The year is 1348. The Black Death stalks the streets. Families whisper prayers in dark homes as bodies pile up outside. A doctor knocks, wearing a long leather robe, gloves, and a bird-beak mask. The mask is stuffed with herbs, lavender, mint, rose petals. Not for you, but for him, to keep away the bad air that he believes carries the plague. You think this man has come to save you, but what he's about to do is worse than the disease itself. They thought illness was caused by humor imbalances. Cure: cut open your veins. Bloodletting: a simple fever. Bleed them. A headache: bleed them. Tuberculosis: bleed them until they collapse. People turned pale, fainted, and some never woke. And where did this treatment take place? Sometimes in your home, sometimes in a dark stone chamber lit only by flickering candles. But the nightmare didn't stop there. If someone complained of headaches, seizures, or madness, doctors believed it was evil spirits trapped in the skull. Cure: trepanning. A surgeon drilled a hole straight into the skull. No anesthesia, just screams and blood everywhere. The sound of iron grinding against bone would echo in the chamber until finally a hole appeared. Sometimes the patient lived, sometimes they died. Either way, the doctor believed he had released the demons. And if you broke a bone, forget casts, forget gentle care. The treatment was hot iron. Surgeons heated metal rods until they glowed red, then pressed them against the wound to seal it shut. The smell of burning flesh filled the air. The screams of patients shook the walls, and the pain was described as worse than death itself. Then came the plague. The Black Death swept through Europe like fire through dry grass. Whole towns vanished. 1 out of every 3 people was dead. Doctors, feeling helpless, resorted to bizarre remedies like crushed emeralds and toad powders. Others smeared chicken feathers on boils or made patients bathe in vinegar and urine. Nothing worked. The coughing, the bleeding, the black swellings, once they appeared, death was already at the door. In villages, priests and healers tried miracle cures. They burned incense, rang church bells, whipped themselves in the streets to beg God for mercy. But the plague did not stop. Whole families rotted together in locked houses while the doctors in their bird masks shuffled past, unable to save them. Women suffered just as much, if not more. Childbirth was deadly. Without anesthesia, without sanitation, childbirth was a gamble with death. Midwives used sharp knives, hooks, and forceps in desperate attempts to pull out babies. Many mothers bled to death. Many babies never breathed their first breath. And if a woman was accused of being a witch, her body could be cut open, searched for devil's marks, or tested by drowning. If she floated, she was guilty. If she sank, she was innocent but dead. Surgeries were crude and brutal. Amputations were performed with rusty saws. A man with an infected leg would be tied down, screaming, as assistants held him still. The surgeon sawed quickly, bone cracking, blood spraying, the smell of iron and flesh mixing in the air. Sometimes they poured boiling oil on the wound to stop the bleeding. Sometimes they pressed a hot iron against the stump, cauterizing it while the patient writhed in agony. Survival was rare, but death came slow, either from shock or from infection days later. And all of this was considered normal. Doctors didn't see themselves as torturers. They saw themselves as saviors. People begged for their help. They paid with gold, livestock, or even their last possessions, desperate for hope. But in most cases, hope was an illusion. Imagine lying in a dark room, fever burning, body trembling. The doctor enters. He sets his tools on the wooden table. A knife, a saw, a drill, a jar of leeches, writhing in slime. He mutters prayers, tells you to be still, and begins. Your screams echo off the stone walls, mixing with the chants of monks in the distance. Outside, the bells toll. Inside, blood drips onto the cold floor. This was healing. This was medicine. This was the Middle Ages. And here's the chilling part. These horrors didn't just vanish. They lasted for centuries. Bloodletting remained common well into the 19th century, still practiced in some parts of the world today. Even now, we experiment with medicine in ways that future generations may call barbaric. Think about that. In 100 years, when people look back at us, our surgeries, our experiments, our treatments, what will they say? Will they see us as healers? Or will they whisper about us the way we whisper now about them? Because history teaches us one thing. The line between cure and curse has always been razor thin. And in the Middle Ages, that line was drawn in blood.